We do not have a quorum, as you can see, for this meeting at this point in time, so we will defer any vote on the minutes of the last meeting and the minutes of the meeting before that until such time as we do have a quorum. I'm informed that our chairman, Mark Bullock, is on his way to the meeting, and hopefully he will be here soon enough to join us while the meeting's still in progress. At this time, I'd like to ask our Township Health Officer, Larry Taltone, to provide us with his announcements and Health Officer's report.
Thank you, Mr. Chairman. My report for April of 2009, we did our normal inspections, which were 22 food establishment inspections. We're part of the Township Workplace Safety Committee inspections, which is where we go out and inspect all the Township-owned facilities, and this Township building was one for last month. We conducted 7 pool inspections and responded to 9 complaints consisting of several various issues such as human bite by cats. We had a heavy blood spill from a police crime scene. We had a little boy who got scratched by sticking his arm in a groundhog hole. A couple of dogs. Later last month we had a fox that did test positive for rabies. We had several public health alerts, and as you all know, we've had a concern about swine flu throughout the country. We did meet with Mr. Mark Johnson and Ms. Caroline Frigley from the Pennsylvania Department of Environmental Protection regarding this year's West Nile program. The theme of that meeting was to get better communication. We didn't want to go through the same situation that we had a year ago. I think we've ironed that out, and I think we're going to move forward this year with a whole lot better communication. Fortunately, this year, we may not have a rabies clinic at this time. The doctor who was scheduled for this year has a conflict with his schedule, but we are hoping that there's other veterinarians who live in Radnor Township who think this program is worthwhile and will, contact us and help us out, as with Dr. Donato, who's always available, and he's scheduled for next year, so we didn't want to tax him. We have several temporary events that are coming up. We were out yesterday for the Friends of the Willows Hold Down, which was a very nice affair yesterday. We have the Wayne Jazz Festival that's coming up on the 13th of June, and so ends my report.
Thank you for that report, Mr. Taltone. At this point, we'll depart briefly from our regular agenda. We are going to see a short video clip regarding emergency points of distribution, or PODs, as the acronym has it, POD. And with us to introduce that video clip today is Ms. Sue McFarland, who is known to many of us here in Radnor as the nurse at Radnor High School, and ably cares for our children there over these many years. But Ms. McFarland has another hat that she wears, and she is actually the POD Operations Chief for this area. So Ms. McFarland, would you please step up to this microphone and provide a little introduction? Thank you.
Good evening. As a part of disaster planning nationally and being prepared, there's this national program that has set up ways of reaching the most amount of people in an effective manner. And the pod is the point of distribution. So in the event of a pandemic, that we can receive a national stockpile here locally in any number of places. In Delaware County, there are 16 pods that are being prepared. So at any time, as this team has been notified, we may be notified that we need to put the plan in place. And so I was selected as the operations chief, and I would have to do with putting together a team of volunteers, and those team of volunteers that I'm responsible for would be medically qualified personnel, medically licensed personnel, because we would be involved with the screening and distribution of the national stockpiles, such as if in a pandemic required medication being given, that's what we would be involved in. And you would be bringing in a large population in an area, and they would be brought in and dispense the medication that would be needed. And in so doing, you would be also have a large number of volunteers that would be assisting in this process, so that also my volunteers would be there to help with first aid for community members and also pod volunteers. And I would be, I think specifically I was asked that I would need to put together, I'm trying to think how many volunteers, planning for about 10 to 15 medically qualified personnel screening. That would be per shift, and we are it's 3 shifts that we would be supplying initially. And then also planning for 100 plus additional volunteers that would be trained on site. So that some of the things we'd be looking for is people in the community that are medically qualified or medically licensed. And I have a name of an individual that could be contacted. So if you did fall into anyone in the community here would be interested in participating in this volunteer program, I have the name here. You could contact Larry Bach at his last name is B-A-K, and he's with the Delaware County Emergency Services. His number is 610-565-8700. He also has an email, which is lbak@icdc.com. So that if medically qualified individuals in the community that would be willing to volunteer and be a part of this national process and helping us locally in Delaware County, they could contact Mr. Bach. And I believe there'll be a video that will
And
show.
hopefully we can have that, if it's not on this video, I mean at some point on the scroll, that information on contacting Mr. Bach. And before we start the video, I should mention, if I haven't already, that we're indebted to the Philadelphia Department of Health for providing us with this video. Thank you, Ms. McFarland.
Sure.
It could happen at any time. An epidemic, a pandemic, a bioterror attack. In the event of a crisis, how should public health officials respond? When time is of the essence, how can the greatest number of lives be saved? Hello, I'm Tracy Matisak. What you're about to see is a demonstration of how to set up an emergency pod, or point of dispensing, designed to provide large-scale prophylaxis. With the ever-present threat of terrorism and disease, it is critical for public health officials to be prepared. In this presentation, you'll learn everything from pod layout to crowd control to staff management and more. And our goal is to arm you with information and techniques that could make a critical difference in the event of a public health crisis. As you watch, be aware that you may need to modify certain steps to better fit your particular situation. Overall, however, we hope that the information you're about to receive will provide a template that can be tailored to meet your needs. Finally, we hope that you will agree that the time you spend watching this presentation is time well spent. It's a small investment that could yield life-saving results in the event of a real emergency. Thanks for watching.
The idea here is to try to get as many people vaccinated in as smoothly and efficient possible.
With that goal in mind, supervisors review procedures and provide day-of training to staff members just in time for the hundreds, perhaps thousands of people who will soon line up to be given shots or, if need be, antibiotic pills.
We have a master list of people, and we check off everyone who is working, and then we give them their materials, which include their vest, their walkie if they need one, the information they need to do their job, and then we send them on their way.
Management of the people going through that line and making sure that they understand what's going to happen, how it's going to happen, how long they may be waiting, what the process is, and keeping them satisfied about all of that is key.
On this day, the process goes smoothly as screeners review patient information forms, checking to make sure they are candidates for a vaccine or antibiotic.
And this is the form that the screeners are going to fill out. The most important thing and the first thing that you need to do is to review that form and make sure that it's legible. If you can't read it, neither can anybody else.
On the other hand, screeners must work quickly to keep the process moving.
If you spend time over-scrutinizing that form, it will slow the whole process down, and it sort of defeats the purpose.
That also applies to what's called a head of household form, given to those who would come not for shots, but for pills to take home to their families.
Some of the key pieces will be moving people from the screening area into the vaccination room and making sure we both keep enough people in there to keep the people who are vaccinating busy, as well as making sure it doesn't jam up so much as people can't get through.
That's why carefully planned traffic flow is critical. Patients are given a numbered ticket when they arrive, as well as a basic screening form. Then, if they're receiving shots, they are escorted to a waiting area where they can fill in the requested information.
Emerson Frank Francis, 48 to 60, please.
When their number is called, patients move from waiting in line to the screening area, where their forms will be quickly processed before they are vaccinated. Line staff members assist every step of the way, identified by their colored vests. Once the screeners have verified that all information is in order, the patient is ready to head to the vaccination area or pill distribution area. Just before the prophylaxis is given, the vaccinator assistant will quickly review the patient's form and sign off on it. It's important that vaccinators trust the work the screeners have already done so as not to waste time laboring over forms, which slows down the operation. So here's what the overall process looks like. As patients enter, they are escorted by line staff members to the screening area. Along the way, they are given screening forms to complete while they wait. As their numbers are called, groups of patients leave the waiting area and are escorted by line staff to one of 12 screeners in the main working area. From there, if they are receiving shots, it's a short walk to the 12 vaccination stations on the other side of the room. If they are receiving pills, however, the process is slightly different and usually faster. Screening forms are filled out and reviewed while the patients are in line. If there are no concerns about allergic reactions or drug interactions, the patient is escorted by line staff to express dispensing, where they can quickly pick up pills for themselves and any family members. If the medical form does indicate a possible allergic reaction or drug interaction, that patient is escorted to the screening area, and when the appropriate antibiotic is determined, is escorted by line staff to one of several dispensing tables where they will receive the proper pills for all household members.
Once you've completed giving your patient your vaccine, please ask them to exit through the door, and then another patient will be sent to you.
It's important not only to set up an operation inside the building, but the entire perimeter outside the building to ensure good egress and just to keep the people moving to get as many people through an operation as possible in a safe manner.
I'm going to walk you through the whole process.
That's why a police presence is essential before, during, and after an operation, not only for security's sake, but also to assist in any emergency.
We still have 1,850 doses in the supply room.
Throughout the day, staff members keep a close watch on the amount of available prophylaxis, which is stored in the supply room, along with all the other materials needed to administer these items. When the supply is down to about 50%, it's time to reorder.
We report once an hour on the amount of vaccine that we have available and how many shots we've given. We would also report on any critical shortages of any other supplies or needs that we have.
That's where the supply room supervisor comes in, who keeps track of inventory all day long and records the information on an ever-changing chart.
The chart will easily tell us the amount of vaccines that we have in the supply room, so we know when we reach that point, we can always go out and get some more.
A nearby command center serves as home base for managers throughout the day. It's a place where they can regroup, communicate, and evaluate the pod's progress. A first aid room stands ready in case a patient or staff member needs medical attention.
Line management is critical for a pod operation, where we have to be effective and efficient in what we do in order to get these individuals through the process, and that when they get through the vaccination area, they know what to expect.
Are you sure of your assignments today?
The logistics lead manages line staff, making sure everyone knows what to do. It's important for the logistics lead to rapidly assess his or her staff to determine whose personalities are best suited to the critical job of directing traffic smoothly and efficiently. The logistics lead should also know when it's time to rotate staff.
A pod operation is in effect during a critical time. We're distributing prophylaxis in mass distribution. So we need to have our staff well rested and have some sense to handle these people who are coming through effectively and with as much care as they possibly could.
A break room is set up so staff members can recharge and refuel during the day.
The vaccinators will be working in pairs. There'll be people drawing up vaccine and assisting the vaccinators.
On the operations side, one staff member quickly checks and signs the patient's paperwork and draws up vaccine while another administers the shots. When staff members notice vaccine running low or need help with a problem or question, they simply raise the color-coded sign to alert a manager for assistance. A red sign is a request for help. Green means the team is ready for another patient. Runners replenish dwindling supplies wherever they're needed in the pod.
If one area seems to be getting backed up, we try to move staff from one area to the other. We do that fairly cautiously because when we do it too much, it seems to take more time.
It can also take more time to service those with disabilities or those who speak languages other than English. The pod has screening forms in a variety of languages, as well as people who can help interpret them.
People who don't speak English should come through, and we have translators.
So a high-functioning pod requires a variety of staff members with a variety of skills working within a structured command system. An organizational chart might look like this. At the top is the pod manager, who oversees the entire operation with the help of an assistant manager. Reporting directly to them are the medical or operations lead, non-medical or logistics lead, and the line lead. The operations lead oversees the whole prophylaxis process as well as the staff. This includes a screening supervisor who oversees 10 to 15 screeners who review client screening forms to determine the appropriate medication or vaccination to provide to the client, 2 first aid staff, a medication dispensing supervisor or vaccination supervisor if the pod is administering vaccine, and 10 to 15 medication dispensing or vaccination staff. The non-medical or logistics lead oversees 4 registration, training, and break room staff, the supply supervisor who manages the medication and supply inventory, the runners who deliver supplies to the function areas as needed, and the facility supervisor who addresses building maintenance and housekeeping needs. The line lead ensures smooth client flow through the pod and manages the line staff, who may include community leaders, translators, and behavioral health professionals.
Philadelphia's first flu vaccine clinic opened today. Will there be enough of the vaccine to go around for the season? We'll tell you.
It's important to remember that any mass dispensing effort may well attract the news media. Reporters can be your greatest ally or your worst nightmare. The key is to be ready for them by having a knowledgeable pod manager on site.
We don't want to create a panic and take any risk that the wrong message gets out to the public.
That's why all staff members should refer media inquiries of any kind to the pod manager.
It's important that you stress that you guys are all busy doing your jobs and that there are a sufficient number of management staff here who are prepared to talk with the press.
To review, the elements of an effective pod operation include smooth traffic flow. Line staff must keep the process moving and do everything possible to prevent backups. Competent screeners. Those who check patient screening forms must do so thoroughly, quickly, and accurately so the vaccination or pill dispensing teams don't get bogged down in poorly done paperwork. A well-stocked supply room. The supply room supervisor must keep track of inflow and outflow and make sure nothing runs out. Effective communication. Managers and staff must be in constant communication to make sure the pod runs smoothly and must respect the chain of command. Proper training. Every staff member must thoroughly understand his or her responsibilities. Media preparation. The pod manager should determine where, when, and how to handle the news media and be prepared for interviews. Security. A police presence is essential before, during, and after a pod operation. In a real emergency, Philadelphia public health officials could have to immunize 1.5 million people in 48 hours. Time is critical, and so is preparation. The threat is real, the future uncertain, but a well-planned public health operation could be the difference between a crisis and a catastrophe.
Well, thank you for presenting that video, Ms. McFarland and Mr. Taltone as well. Is there anything further that you think our viewers and we, the Board of Health, need to know with regard to this presentation? Any follow-up that we need to take?
I would probably say not at this time, but I would be interested in coming back in the future with more information as it becomes available.
Sue, I just wanted to ask, will there, as I said, I'm interested in volunteering, so I'll contact Al Bach at icdc.com. And then what would be the next step? What would happen then?
We should be you would be contacted by Mr. Bach, or your name would be depending upon the area where you're located, you would be assigned probably nearest where you are located, and so that your name then would be perhaps most likely given to me. As I try to look for extra volunteers as well, I'm looking at our local medical offices, the nurses that work in some of our doctors' offices locally to get more volunteers. We need to be prepared that if you have a pool of volunteers that are medically qualified, you have to assume that when we get the call in a disaster, we may have 50% of those people available. So we want to have a good pool so that when contacts are made, we know that we would have sufficient staff to cover our pod. Okay.
Just while you're here, I also want to just touch base with you about the planned influenza clinics. So I understand you have them scheduled. Are you going to be offering just the intranasal vaccine, or
the intranasal for the students in the middle and the high school at present, and still would want to explore the availability when it would be apropos to initiate this at the lower level, the grade school.
What would be the steps to help bring that about?
I bet you might be helpful in that venue.
To do what? I mean, I have tried in the past, and would be happy to try again if you would suggest what you think might be helpful.
Okay, I will, check with my administration, and I think whenever we can move forward, the more, students we can, protect, the greater the protection of the school environment as well as the community.
I mean, I think it's not at all unlikely that this coming fall, in addition to seasonal flu vaccine, that there would be an additional, H1N1 swine origin vaccine, and that would likely be a 2-dose vaccine for everybody, so that people in general might need 3 doses, 2 of the swine flu, 1 of the seasonal flu, except for children between 6 months and 8 years of age who are getting it for the first time, who would need 2 doses of both vaccines. So, we might really be looking at something that pediatric and family physician offices logistically would really be unable to manage in terms of really providing it for all their patients. And I think schools are certainly a logical place to reach the vectors of these diseases, as well as, the children being at risk themselves. Do you have any suggestions of how we might increase participation in just the seasonal? Let's just assume for the moment all we're doing is intranasal vaccine at the middle and high school, since we're pretty sure that'll happen, that those flu clinics will be offered. Do you have any ideas about how to increase participation?
I would say on the cable, our local cable station, and emails through the schools where the parents have given us their email addresses to do it that way, and also the newsletter.
Because I know in the past that you have announced it through the newsletter.
And each year, a little more participate, but certainly not enough. And I guess the feeling is that, hopefully each year a little more. I almost feel that with the press that the swine flu has gotten, that I think people are more heightened awareness of the seriousness, because not only when they're talking about the swine flu, they mention that there are deaths amongst people who have flu, that it's not just the swine flu. But I think more information has disseminated in the local press, the news media, the newspapers. Just about any magazine you pick up right now has got an article in that area too. So I think with heightened awareness, that people might be more inclined to feel the protection is really necessary.
Thank you.
Are you getting the sense from, and this would be the 3rd year, correct me if I'm wrong, Amy, that we're doing the intranasal flu mist? Do you have a sense that the low participation reflects the fact that kids are getting their influenza vaccines elsewhere from their regular source of health care and bypassing the school? If so, that would be great if they're doing that. If they're in fact unprotected, then that's another issue, and we have to address it more aggressively.
Numbers I'm not aware of, but I know as I do get health records on students that I do get some kids that have their physician mark on their form that they've had it, but the numbers I'm not aware of, so I would assume that some are getting it through their family physicians, but I would garner to say that not enough.
What is the, just to give people an early heads up, what is the target dates for doing this, the range of dates for doing this again in the middle and high school?
In October, you usually try to get it in October, November, but they say you can protect yourself up through March. So we would like to get the students. We were not as fortunate. I think November was the dates we had the last 2 years. Having signed up early enough, they are now in the process of assigning the dates, and we signed up for a date in October, which we are assured that we will have an October date for the middle school and high school.
Thank you. Thank you very much. Any other questions of Ms. McFarland? If not, it gives me great pleasure at this point to turn the meeting over to our president, Mark Bullock.
Thank you very much, and I apologize again for being late. I actually have another job, and it ran long today, so I apologize for that. I believe we have a quorum now. Is that my understanding? So we can quorum of the members, so we can address the minutes. So let me see. Actually, do we have a quorum? How many do we have? 1, 2, 3, 4. We need 5. We need 5. We're one short. Okay. Yeah. All right. Well, we'll hold those to next meeting for approval. In the meantime, does anyone have any comments or questions to the minutes? Any follow-up? Great. Thank you. Larry, health officers report, or we've done that? Okay, thank you. 5, okay. EAC update. John, what we do need to discuss is a liaison with the Environmental Committee.
Mark, if you recall at the, I guess it was the March meeting, I had indicated that I would be doing that at least through this year and see how that goes. I did attend the last meeting of the EAC as this board's
something
liaison.
that you found interesting, or is there anything?
It was interesting. It's a matter of the time element that's involved. It is an additional meeting, and at this point I can do it, and we'll just have to see that. But my commitment is through the end of this calendar year. At any rate, give you a heads up before we get to the end.
Right. Well, I appreciate your willingness to do that, and I understand the additional time. Is there any report then to the committee now?
Yes, as I indicated, I did attend the April meeting, and there were actually 2 major presentations at that meeting that I can talk about a little bit. One was on the Township's solid waste and recycling program, and we had a lengthy presentation by 2 of the Township's employees. And if I thought I had it turned to the right page, we had a presentation by the Township's Director of Finance, Amy Cuthbertson, William Hagan, Director of Public Works, and Peggy Hagan, who is a recycling coordinator. Ms. Cuthbertson went through the costs involved in the township's operating and disposal costs for trash and recycling services, and she gave us a lot of figures, and they're quite detailed. But one of the problems that the township is now facing is that starting in November of 2008, the recycling market bottomed out, in her words, and the township has begun actually paying to have our trash, the recyclables, plastics, glass, and metals, paying for that to be picked up. So that's a factor in our township's budget. We also got an overview of the township's trash and recycling collection operations procedures, what they do, just to cite some figures, and they're pretty amazing. The solid waste collection total for 2008 was 9,772.5 tons, or 50 pounds per household per week. And that was actually less than previous years. So people are doing a good job of taking care of their trash. And that was the major part of the presentation, just how the township handles our solid waste and recycling programs.
Just a quick question on the amount of trash and garbage and whatnot. Did they give you a breakdown as to what would constitute the percentage of the amount of waste produced? Like, is it newspaper adding up to a significant portion, or do they even have that kind of level of detail?
Well, actually, no, I don't recall that level of detail was included in the presentation. I can, since Mr. Hagan was very knowledgeable, and Ms. Hagan was also as well, I can contact them and find that out.
Yeah, just in the and maybe this is beyond the realm of this committee, but just to help people kind of understand where their biggest areas for improvement are with regard to their trash. Like, if you get a lot of newspapers, maybe you say, well, maybe I do this online rather than filling up landfills with newspaper. Or if it's some other product that they can begin to say, well, maybe there's an area where I can begin to diminish and reduce my use of resources.
They do have a census for businesses to fill out each year on what kind of recycling that business is recycling, and I don't know if we would have information on that.
That's true. For commercial totals, there was a comprehensive breakdown, and just for paper, there was a total in 2008 of just under 1,400 tons. For mixed paper, about 650 tons, and for office paper mixed, office paper about 470 tons. And there are other breakdowns for glass, for example, by color of glass, if you're interested. Almost 7 tons of brown glass, a little over 16 tons of clear glass, and about 5 3/4 tons of green glass.
It's a lot of beer bottles in the brown glass.
Yeah. I should point out that the township is apparently considering going to a single stream recycling program, and What that means is you wouldn't separate in your house the paper from the other, the plastics and the metal and glass, but keep it all in one, and then it would be separated further down the line, post pickup from your home. John, you're nodding your head. Do you have more information on that?
We've been looking at that for the last year, and it's certainly a cost-cutting measure, but it also has a benefit in the utilization. I know Philadelphia saw about an 8-fold increase in recycling when they went to single stream. So I don't know if we're going to do that, but it's certainly a decision we're looking at. It's expected to save about $350,000 a year in recycling costs. And like Herbert mentioned, all the materials they're separated in a facility with an automated process, so it doesn't apparently seem to be a cost associated with that yet. I guess down the road at some point we'll see that all change anyway, you know, and that what's free now ends up costing us later. But hopefully, if we make that change, it'll have a benefit in the recycling as well as cost savings.
So, so is there any reason not to do it? Are there any cons to it?
Well, I guess it wasn't really an option just in the last 6 months because there weren't any separation facilities in the area, but apparently that's changed. And I'll also comment on the commercial side, there weren't many commercial trash services that offered recycling, so that's something new in the last year. No, I would say there's really no reason not to do it. We do have equipment and capital equipment tied up in the separation of materials at this point, so we have separate bottle and glass trucks versus trash trucks for paper. So I guess we're trying to eke out the value that we've invested in that equipment, but at some point it would probably make more sense to not buy those types of stake body trucks for collecting bottles.
The presentation the cons were totally outweighed by the pros, but just to mention them, currently market changes may allow for source separated items to be sold at varying rates. Single stream collection apparently does not allow for this option. And then there would be a cost of residential mailings, stickers, and or cans for the startup of the program. But just to mention some of the pros, obviously collection of all recyclable items in one can. As John has just indicated, the trash trucks can be used to pick up recyclable items, and therefore the recycled trucks can be sold, providing some one-time income, I suppose, for the township. And as John mentioned, with the Philadelphia experience, the ease of use makes it more easier to sell to our residents, and curbside collection and single stream changeover can happen at the same time. And collection schedule for residential recycling is easier for the residents to follow.
Well, thank you very much for that report. I'll just speak briefly on the medical environment and healthcare access. At the state level, if anyone saw the Inquirer today, there was a report on the state budget. Key wrapped up in that is the Medicaid program, which is one of the largest providers of health care in Pennsylvania. Funding and the allocations of funding related to the Medicaid program are at the heart of the debate in Harrisburg because of the size of the program and its expense. And the governor and the Senate Republicans have differing viewpoints on the allocations of those scarce resources. The state revenue, I think as of the April numbers, the state has for this budget year, their budget year, about $2.5, $2.6 billion in the red, meaning that they have less revenues than they anticipated. The budget for next year doesn't look any better. At least in Harrisburg, it's kind of stay tuned. As everyone knows, states, unlike the federal government, cannot operate at a deficit. So it means a lot of different issues are trying to get resolved in Harrisburg. On the federal side, the big issue is the form that healthcare reform is going to take. I think Senator Baucus' committee is heavily involved in outlining what a health reform program would look like. That includes a number of different issues regarding health insurance, the requirement for everyone to have health insurance, much like the Massachusetts model. The two biggest issues, I guess, with regard to what's going on in Washington and the health insurance reform efforts are whether to include a public option in the health reform. The public option would essentially be a public health insurer. The concerns about a public health insurer are several, one of which is that it would not be required to have reserves like a commercial carrier. That does two things. One, it places it on a par with Medicare, and Medicare, the trustees recently indicated that the Medicare trust fund is going to be broke in 2017, so query what is the financial costs to the taxpayer for the public option. The second issue and the second concern, at least among commercial insurers, is if you have a public option, it would be structured in such a way, no reserves, other administrative simplicities, that it would be very competitive with the commercial plans, and query would the employers begin to migrate their employees to the public option rather than utilize the commercial plans. So a significant issue and impact to all of healthcare just on that one particular issue. The other issue is how do you pay for all of this? If we're going to make sure that everyone's insured, and I think everyone supports that concept, it's how does it get paid for? One of the options being floated now is that health benefits would be taxed. Now, there's different permutations on that. What level of health benefits would be taxed? Is it based on an income test? So you would add in the value of your health benefits to your income, and then that would raise your taxable level, and how do you do that? And then there are caps on that. And then the other aspect of that is would you tax for, say, richer plans than a basic managed care plan, say if you would tax somebody higher because they had an indemnity plan. So any number of different issues being debated right now in Washington, all of which could potentially have a tremendously serious impact on the way people get their health care delivered. So try to answer whatever questions I can, but people should pay attention to this. This is a really significant debate going on now in Washington. Can we move now to Radnor Health Matters?
Okay, I've gotten a little bit sidetracked on the application process for funding in terms of completing the draft material, but it will be ready by our, if not by our next meeting, before our next meeting, certainly by that point. And the package will include the draft proposal as well as a letter forwarding that draft to the Township Commissioners with our board's recommendation that they sign off on it so that we can submit it and to the foundation.
So from a process point of view, you envision bringing that back to the board next meeting, and then we can vote on it there and recommend it to the commissioners at that point?
Actually, the way I would envision it is being able to, as I did with the draft, email it to the members of the Board of Health together with the draft letter of transmittal to the Township Commissioners. so that, it's not anything that's completely new when we get to our next meeting. And I hope we would have as good attendance at that meeting as we could possibly have, so that we have we know we're going forward with the full support of the board here before getting it to the township commissioners.
That sounds like an excellent plan, and I fully endorse that and appreciate your efforts on that aspect. The famous fluoride in drinking water. Who wants to update us on that?
As the minutes indicate, one of our members, Dr. Tiniano, had promised that she would, or indicated that she would be doing some follow-up work on that and to bring it back to us, and she is not here this evening.
Larry, would it be possible for you to reach out to Loris and ask her to email us just where she is on her progress related to that? Because I knew that we do eventually want to loop back for further discussion here, and then, assuming everyone's comfortable, make some recommendation to the commissioners.
I'll do it. I'll call her tomorrow.
Thank you very much. And then the flu mist. Any update in addition to your earlier comments?
The only thing I'll add is that I had reached out both to the middle and high school parent-teacher organizations. The high school responded, and I did go speak to the PTO last week to do a general update about influenza in general, the swine flu, and new school immunization requirements coming not for this September but the following year, although the strengthened flu vaccine recommendation takes effect for this coming year, but other state requirements will become effective a year from September, so September 2010. But obviously for something like vaccine, you don't want to wait till they're due before finding out you were supposed to get them for your kids. So I just went over what the new recommendations were and why they were, and the very short version of that is that 2 doses of varicella vaccine, a single dose of tetanus, diphtheria, acellular pertussis or TDAP vaccine, and 1 dose of meningococcal vaccine. And these have become routine. These have been ACIP CDC recommendations for a while now, so these are the routine, and that's partly why there's a lag time in school immunization requirements, because they don't want to require something before the real world has time to make sure that everybody has these vaccines. So I don't think there's any big surprises, but just for parents to be aware that, these will be part of the requirements for school attendance in the state.
And that begins in September 2010?
Yeah.
Is there any merit in along those lines to make sure, as you've indicated, that kids are fully up to date in terms of those prospective requirements well in advance? Is there any merit in this board working perhaps with the school district to get word out to parents well in advance?
There is a state flyer that has sort of a child with an apple on it saying, don't wait, vaccinate, these requirements are coming. So I did give that to the PTO and gave them the link for so they could actually put the file in the newsletter. So I hope that will be going out.
So the confirmation is either the child gives the slip from the doctor saying this happened, or they have it done at the school? Is that the...
No, the schools in this area, some schools have what's called catch-up programs, which would be what you described. No, in our district, and the way it works statewide is that either you provide proof of immunization, in some cases proof of having had the disease is acceptable, or serology is acceptable for some, not for all vaccines. So depending on the vaccine, providing the appropriate record, or if it is not provided, the parent has the option. In Pennsylvania, we have a religious or philosophic exemption as part of the regulation. Parents can complete that if they wish. Of course, the downside of that is not only is the child vulnerable and capable of really impacting the herd immunity of the whole community, but also if there is a case of that vaccine preventable disease, that child will be excluded from school for the duration of the incubation period of the most recent case, which can go on if there's something is kind of percolating along, really can extend for months. But short of that, they cannot attend school if they haven't done one of those things. If, for example, you have someone who was new from another country and who couldn't possibly get all 3 doses, as long as you have begun this series and keep up with the appropriate dosing intervals, you can attend school.
In your experience, is the medical community aware of all, or will they be aware of all of these requirements? Because I guess a lot of people will have, if you have a unique circumstance, you'll have those questions. And is it the medical provider that you ask those questions of, or is there a state agency, or how do those questions get answered?
Well, partly through professional organizations like the Pennsylvania chapter of the American Academy of Pediatrics and the Pennsylvania Academy of Family Physicians, the Pennsylvania Osteopathic Medical Association, the Hospital Association. All these organizations do receive and have received this information from the State Department of Health immunization program. So there are a variety of ways that anybody who's a potential vaccinator has been and will continue to be notified about this. So, and as I said, these recommendations are the routine. They're part of the standard recommendations that come out from the Centers for Disease Control and the American Academy of Pediatrics, the American Academy of Family Physicians every year. So they're already in place. So there's nothing special. The school regulations tend to lag behind medical practice just because of really logistic reasons and how long it takes the state health department to get a regulation passed. So
I appreciate those insights. Thank you very much.
Before we leave that, I'd like to just do a tickler or something on that and perhaps revisit this issue sometime early in the next school year, because I just would like to try to be as proactive as we possibly can in getting the word out. I know, I've been at PTO meetings, and not every parent, as you know, attends those meetings, and it will allay my concerns if the school district is taking it upon itself to get that word out, but I'd like to be absolutely sure that they are. And so perhaps we can revisit this sometime.
I mean, part of my reason of going to the meeting, there's very few parents there, but it goes in the minutes and it goes into their newsletter. So, and the school nurses, are on top of this as well. So, because they're the ones that have to review the records, so they don't want to be excluding children. So,
well, Larry, if you can play something for the minutes or the meeting right after our summer break, I think that would be the best approach. And Amy, thank you for taking the time to actually go to the school board meeting. I mean, that's really shows your commitment to not only the health care of the community, but to this board to really get actively involved like that. So very much appreciated for myself, and I think I can speak for the committee as well. Is there any new business before the committee?
Not really new business, but as we all know, we have 2 vacancies on this board, and I don't know if there has been any progress to date on filling that. The process, as I understand it, is that people would send a letter of interest to, as I recall it, in my process, it was the township manager, and then be interviewed by the township commissioners. So I don't know how close we are to filling those vacancies.
Yeah, I ask if anyone's interested in applying for the position on the Board of Health to send their resume to the attention of John Granger, Radnor Township, 301 Ivan Avenue, Wayne, Pennsylvania, 19087. We have not received, as far as I can tell, any resumes from medical professionals or any others in the medical field that are interested for the positions, the open positions on the Board of Health. But I certainly will make another announcement at our next meeting. And I also asked the Board of Health members, to maybe kind of put the word out among your professionals and try to get some interest there as well.
Along those lines, I think in reading about the preparedness issues, I was kind of interested in seeing about getting a pharmacist on the board. And I didn't know if, I don't personally know any, so I can't use my connections, but I don't know if others may have thoughts in that area, because school health, dental, veterinary, I feel like we have done a good job at getting representation from some different groups, and I think that would be really
That's a great idea.
Really good.
I think I'll challenge all of us to think about who we could connect to the committee, and maybe next meeting, even for those, Larry, who are not here tonight, let's challenge them as well to come up with at least a name of someone who could potentially be interested and participating. Pharmacy, I think, is a great idea. And John, if you have anybody that you would think of, and even non-medical professionals, someone who is interested in the health field is always important, because it's more than just strictly health. So, community involvement is always important.
I wanted to quickly just make a comment about about West Nile, and encourage everyone to make sure they're managing their groundwater in and on their properties, because there's a particular disease that is hitting bats right now and killing about 90 to 95% of them. So there might be a cave that has 100,000 bats that's losing 95,000 of its residents. And the problem with that is each bat, from spring till winter hits, they will eat 1 ton of insects. And if we're losing that many bats, we're going to have more issues with West Nile. So just make sure we're managing our groundwater right now as best we can, because we'll start to see an increase in the number of insects with how this is migrating across the country in about 2 to 3 years.
Len, and that includes, like, if you have a bucket outside that fills with water or anything of that nature, anything that's accumulating water?
Anything that accumulates water, flower pots, little ponds, waterfalls, anything that you have, just make sure you're maintaining it well.
That's important. What is the disease, or they don't know?
It's called white nose syndrome. It's a fungus that is growing on all of the bats and making them leave the caves early, so they're in search for food in the middle of the winter and then dying. Yeah.
It's terrible. Well, on that somewhat happy note, or not unhappy note, if there's nothing else before the committee, we'll call the meeting adjourned. Thank you.